It is now with my great pleasure to introduce the 2026 Class Day speaker, Dr. Monica Bharel. Dr. Monica Bharel is a physician executive, internist, and public health innovator dedicated to using data, technology, and policy to drive innovation and equity in health. She is the clinical lead for global public and public sector health at Google, based on the Google Health team. In this role, she oversees an international team of clinicians focused on bringing technological innovations and AI tools to public health systems to reduce global health inequities. Dr. Bharel previously served as a senior advisor to the mayor of Boston, enabling a multi-agency overhaul of this city's response to homelessness, mental health, and substance use disorders. Prior to that, she served as a commissioner of the Massachusetts Department of Public Health from 2015 to 2021. As the Commonwealth's chief physician, she oversaw the state's aggressive response to the opioid pandemic and the COVID-19 pandemic. Prior to becoming commissioner, she was chief medical officer of Boston Healthcare for the Homeless Program, the largest such program in the United States. She earned her medical degree from Boston University School of Medicine and her Master of Public Health from the Harvard T.H. Chan School of Public Health. Through the Commonwealth Fund Health Policy Fellowship, she completed her residency and chief residency in internal medicine at Boston City Hospital, Boston Medical Center, and has practiced internal medicine for over 20 years. As a fellow Harvard Chan alum, I'm personally thrilled to welcome someone who has shown what public health leadership can actually look like in practice. For many of us graduating today, she represents the kind of physician leader we hope to become, someone who has consistently chosen service, equity, and courage in moments that demanded all three. Her career reminds us that medicine does not end in the clinic. It extends to policy, public health, advocacy, and the systems that shape whether our patients ever have the chance to be healthy. At a time when public health leadership has never been more important, her work stands as a powerful example of what it means to serve communities with both compassion and accountability. Please join me in welcoming our 2026 Class Day speaker, Dr. Monica Bharel.
Hello, good afternoon. I have a job to do here, but I'm so pumped up from these speakers, these student speakers. I'm just like, let's get ready, let's go. Let's give one more round of applause to all the student speakers. To the graduating students in the class of 2026, congratulations. I'm so happy to be here with you to celebrate and reflect on this important day for you and your family and friends. To the faculty, staff, family, and friends, you supported these graduates on their educational journey. I share gratitude for your work to launch our next generation of physicians and dentists. I also want to extend my deepest gratitude to the facilities and maintenance staff. It's your quiet, essential work that makes moments of celebration like this possible. Did anyone else watch the journey of the Artemis crew to the moon and back with pure awe? There is a phenomenon described by astronauts when they see Earth from space for the first time, known as the overview effect. As astronaut Christina Koch described it, from that height, you don't see borders, religious lines, or political boundaries. All you see is a single, fragile, and beautiful Earth. You realize we are far more alike than we are different. I've never been to space, but I have spent my career as a physician and a public health professional, and I believe that medicine can offer us an earthly version of that overview effect. When you walk into an exam room, there's a profound shift in perspective. The patient in front of you is simply another human, entrusting you in their most vulnerable times. The person in front of you might look different, might speak a different language, or have different beliefs, but in that relationship, they are simply our patient, bound by the exact same fragile human condition that we are. So let me start by welcoming you into this profession. We are privileged to see the shared fragility and beauty up close. It's a view that most people never get, and it's a view that changes us forever. Having graduated medical school over 30 years ago, I can tell you that it can be hard to hold on to that awe. But in my most challenging professional moments, being able to recenter myself in that truth has given me strength and resolve. This is an amazing time in modern medicine and a time of great advancements and innovation. Even the skies are opening up to welcome you. When I graduated medical school in 1994, AIDS was the leading cause of death in Americans aged 25 to 44. I spent my clinical clerkships caring for patients with pneumocystis pneumonia, cryptococcal meningitis, and Kaposi sarcoma. Today, we have thankfully moved beyond opportunistic infection treatment and AZT monotherapy to treating patients living with HIV as a chronic disease with effective and easily tolerable treatments and therapeutic tools for prevention. The advancements have not been limited to HIV. Oncology has undergone a revolution where 60 years ago, a child diagnosed with acute lymphocytic leukemia had almost no chance to survive. Today, the cure rate for this childhood cancer is over 90%. And all of this is not even taking into account the ways in which artificial intelligence is already changing our practice and research endeavors. In 1994, determining the 3D structure of a single protein could take years using X-ray crystallography. Today, we can predict the structure of nearly every known protein in minutes, changing the workflow to allow for faster drug and vaccine development and paving the way for new treatments for conditions like malaria and liver cancer. Our patients are turning to social media and influencers for wellness hacks. They can greet us in clinic rooms with a differential diagnosis they've looked up online. There is immense potential here, but also risk. And we will need to stay engaged to ensure appropriate guardrails in our collective goal of do no harm. This potential is amazing and a cause for optimism for advancement in human health. I believe many of you graduates sitting in the audience today will be at the forefront of these innovations in basic science, clinical care, translational and implementation science, and dental and physician care. You're entering the profession at a time of great change. And yet, there is a paradox. We have the technology to map a protein in minutes, but globally, a woman dies every 2 minutes in childbirth. Not enough has changed. In 1994, roughly 1 in 11 children globally died before their 5th birthday. Thankfully, that number has improved to 1 in 27 today, but the progress is not equal. In sub-Saharan Africa, it remains a staggering 1 in 14. In a world marked by brilliant medical advances, over 2 billion people don't have access to essential medicine, including basics like insulin and antibiotics. And this is not just a faraway problem. Right here in the United States, the maternal mortality crisis for Black women has actually worsened since 1994, leaving Black mothers over 3 times more likely to die from childbirth than white mothers. Coming closer to home, a person living in the Back Bay can expect to live 23 years longer than a person living in Roxbury. In this 2-mile distance, surrounded by the best healthcare systems in the world, A person's zip code is still a more accurate indicator of life expectancy than their genetic code. Closing that gap requires us to look beyond our clinic walls. In 1984, the medical establishment believed the deadly cholera outbreak in London was caused by bad air. But John Snow looked at the environment. He mapped the deaths on a street map and traced the outbreak to a single contaminated drinking well. This early example of spatial epidemiology saved lives decades before the Vibrio cholera bacteria was even discovered. At that time, John Snow said, "You and I may not live to see the day, and my name may be forgotten when it comes, but the time will arrive when great outbreaks of cholera will be things of the past. And it is knowledge of the way in which the disease is propagated which will cause them to disappear." And yet, over 170 years later, cholera is not a thing of the past. In 2025, this entirely preventable disease caused over 600,000 cases globally. That is why here today, I ask you to take a public health approach to every patient you meet. Your degree today gives you great authority to treat and prescribe, and you will enter a position of great trust and responsibility in our society. I hope you can take a holistic approach to your care. Is a patient not taking their medication because of non-compliance or non-access? Is a patient's tooth decay a result of poor oral hygiene or a lack of access to fluorinated water and dental insurance? How is their housing status, their neighborhood, or their access to food impacting the symptoms at the bedside? When I was an intern, a patient in my primary care clinic taught me this lesson in a way I will never forget. I was proud of my training and eager to share preventive health knowledge about nutrition and exercise. One evening in clinic, my patient politely told me what I was suggesting was simply not possible. If she ate the food I recommended, she would run out of money by mid-month. After working 2 jobs as a single mom, she didn't get home until after dark, and her neighborhood wasn't safe enough to take a walk. My patient was a reminder that 80% of our health is determined outside of the healthcare system in the environments we live and work in. This was part of my motivation to focus my career on understanding the factors that allow people to access health. So what can you all do about this? As you enter the profession today, I ask you to let these principles guide your work. First, consider what the political philosopher John Rawls called the veil of ignorance. If you applied this to healthcare, you would ask yourself, how would I design the system and distribute its resources if I didn't know my place in it? If you were starting from scratch and didn't know your place in society, would you really design a healthcare system where dental care wasn't a basic part of insurance? Or where transportation costs caused a patient to miss a medical appointment? As you develop into our leaders, please consider the fairness in the systems you work in. Are the policies of your health center, hospital, or health system fair? If not, advocate to change them. Build for those who are hardest to reach. Think of my former patients at Boston Healthcare for the Homeless. If whatever you are designing will be accessible to them, it will be accessible to everyone. When we intentionally build for those of us who have the hardest time accessing care, we improve the system for all of us. Stay as close to the patient voice as you can. Last week, I was at the WHO, and a colleague of the Director General shared with me that the director insists on going to the field to meet the people impacted by global emergencies. Even at the highest level of global leadership, staying close to the community you serve is critical. And look for the ankle weights. When 2 runners compete, If one has heavy weights on her ankles, it will severely impede her capacity to finish the race. Ask yourself, what might our system be inadvertently creating that acts as ankle weights for our patients and widens health disparities? And finally, in the leadership positions I know you will have, please ask, who is missing? Who is not walking through the clinic door? Who is not the decision maker at the table? With my requests above, you might ask, where do I begin? Some students have asked me how to advocate when you feel you are a junior member in a large and impersonal system. Students ask, how can I be a leader in state health or run a health system? When we think of health advocacy, we often think of policy with a capital P. For me, that has included changing tobacco laws to prevent access to youth, or running a health department and prioritizing the new COVID vaccine for equitable distribution to include those experiencing homelessness or in the criminal justice system. As you scale your impact, you will see the ripple effect of that big picture policy work. It will be thrilling and it will be important and it will be necessary. But that is not the starting point. The starting point is policy with a lowercase p. Lowercase p policy begins at the patient level. It starts when you look at a single person's barriers and refuse to accept it as an individual failure. For example, consider a patient who doesn't own a smartphone. Because they don't have a digital device, they miss the automated text reminder to confirm their colonoscopy appointment. The system automatically cancels the slot. The chart is marked as missed appointment. This structural barrier is unintentional, but will take your intentional advocacy to change it. By bringing awareness to your clinic, you can change the standard operating procedure for all patients. You might create a workaround, like a designated landline callback system or a community health worker outreach protocol. That is how a lowercase p policy scales. You take the lesson learned from one vulnerable patient and use it to rewrite the rules for everyone to benefit. By doing the job of today with awareness and humility, simply because it's the right thing to do, you will ultimately succeed in reaching your policy with a capital P goals. But while policy changes the system, it's our humanity that changes the patient experience. In an age of advanced technology, now more than ever, we need your humanity. You will have to work extra hard for this. Find the 2 extra minutes on rounds to let the patient finish their sentence. As a junior resident, boldly bring the team to the bedside to talk to and examine a patient. Find your way in your own style. I used to round with an attending who would bring a small stool on rounds with him to sit with the patient instead of towering over their beds. All of these commencement speeches talk about spending time at the bedside because it's important for the human touch, but we don't do that. Our systems are not set up to encourage that. Can you change that? Despite the system, what can you do for your patients and for yourself? I challenge you to find small, daily ways to do this for yourself and for your patients. My very first patient when I was a third-year medical student on my medicine clerkship was a patient who had just received his diagnosis of HIV. I was prepared with all the data about his case, next steps, and what we would do next. But his first question to me was, what will I tell my mother? All the facts receded, I sat down, and we simply talked. These moments of human connection make the long hours and the challenging schedules manageable. Find a way to hold on to this. But to do this, you must also preserve your own humanness, your own imperfect but authentic self. In medical school, I was a master of compartmentalization. You likely also have already have this skill because the demands of our work require it. By the time I had children, I was effortless at it. I could deliver bad news at the bedside, be part of a code where we tragically lose a young patient, rush to daycare, suppress the guilt of being the last parent to pick up again, and then read a bedtime story to my kids about saying goodnight to a moon. I was brave and strong and proud of myself for that. But now I know it has an impact. In this current age, even more, our attention is being courted from many angles. Make an effort to go analog in your free time. Connect with purpose with your friends and family. Fiercely protect your ability to think deeply, to read fiction, and to be with the people you love. I notice this most when I'm on the other side of the doctor-patient relationship. I went into medicine because of the influence of my first and best mentor, my dear dad. He was a proud immigrant and a primary care doctor deeply devoted to his patients. When we lost him a few years ago, we were grateful to be at his bedside when he took his last breath. The MICU attending came in personally to perform the extubation. He didn't delegate it to a resident. He didn't rush. He simply stepped into the room to quietly, physically bear the weight of that moment with our family. He wasn't looking for credit or accolades, but simply honoring the profound privilege of being present at the end of life. I never told him how important that was for me, but I still remember that small act of humanness 3 years later. How we show up at the bedside matters in ways that go far beyond what can be captured in a medical record. As Maya Angelou famously observed, people will forget what you said and people will forget what you did, but they never forget how you made them feel. Consistently making your patients feel seen and valued in a system that feels like it prioritizes speed over presence is not easy. What I'm asking of you for the future of medicine and what I'm asking for you in your daily work will take fortitude, optimism, and resilience. I believe you have all of that because you're sitting here today. And it will take embracing a personal vision of your life that does not change regardless of the circumstances. Find the belief that drives you. For me, it's a belief that all people should have access to health and that people are healthier when they're free to make health choices for themselves and their family, when they have access to education for their children, stable housing and employment, justice and fairness in health. For me, it's about conducting my duty to the profession with patience and humility. Find what drives you and go back to that belief with every professional decision you make. Hold on to your humanity and care for yourself while caring for your patients and your loved ones. Take a public health approach to your work and try to retain the awe of it all. The awe brings us back to the astronauts we started with. The Artemis crew didn't just show us the moon. They reminded us of the shared fragile beauty of our own Earth, giving us the ultimate public health perspective. As astronaut Victor Glover said, "Trust me, you look amazing. You look beautiful. And from up here, you look like one thing. No matter where you're from or what you look like, we're all one people." I know that as the next leaders in your field, you have great potential to address the needs of our time, of our one people. I'm thrilled to welcome you to this most honorable profession, and I am so proud of you. Congratulations, graduates.